continue to celebrate the improvements and the achievements of the Queen Elizabeth Hospital, as we as a people, grateful people, say thank you for the developments that we're seeing there. Part of which is the opportunity now for Barbadians to have world-class treatment should they be diagnosed with cancer. So joining me this morning to talk a little bit more about where we are now and what those pieces of equipment are really meant to do is Corey Drakes, who we met before as a, what do you call this? A linear
physicist.
Right.
And the linear accelerator.
Right, the linear accelerator, and a big physicist. And so with him is Dr.
Sripathi.
Sripathi.
Yes.
Sripathi.
Yes.
Okay, good. Welcome, first of all.
Thank you.
Starting with Corey, let's talk a little bit about the work and what that accelerator is designed to be able to do as it relates to cancer treatment.
Sure. So the medical linear accelerator, called the Halcyon, is a radiation therapy delivery system. It's quite modern. It has onboard imaging systems that would allow us to, verify setups, because the tissues in the human body, they move, and therefore it's important to image first before delivering this conformal, highly precise and accurate radiation therapy to our cancer patient population.
Before we had this, what did we do?
So we were reusing cobalt technology. It was the technology of the time. As mentioned previously when I was here, that was the technology that we were using to deliver cancer treatment. However, as medicine evolved, as technology evolved, our healthcare system also had to evolve. And I'm truly thankful for the government of Barbados for this investment, for the management at the hospital, for actually seeing the value that this technology would bring to the patient population of Barbados.
So with the evolution of technology and what this now brings, does it mean that we get faster, more accurate diagnoses? What?
Sure. So the technology itself is for treatment delivery. It doesn't mean that the prevalence of cancer would increase, but we would expect to see increased numbers because persons will stay home to receive this world-class health care. But it is a faster delivery system. As I said, it had more capabilities than the previous system, and therefore the Barbadian public can look forward to receiving world-class health care right here at home.
Dr. Sripathi, how do you interact with this particular world-class standard in treatment care?
Well, I'm really happy to be a part of it in the first place. And with this, we are able to provide modern radiation treatments on par with what happens in developed nations. And we are able to give this high-end advanced radiation treatments to almost 95% of the population. I mean, the most common cancers that are seen here. We give radiation treatments to almost all sites. From the time we started using the machine, we have treated lung cancers, uterine cancers, cervical cancers, head and neck cancers, high-risk prostate cancers, breast cancers. We have literally treated almost every kind of solid tumor that is possible. So with this machine, we are capable of providing those high-end radiation conformal treatments, which gives us better outcomes with fewer side effects, obviously, to all our population here.
This is a real great leap ahead from where we have always been. And so oftentimes we always wonder about recovery period. Does it also shorten or help to shorten recovery periods?
Definitely. Because like I said, we have transitioned from cobalt to Halcyon, with which we are able to provide image-guided radiation treatments. By that, what I mean is we would know how much radiation dose is going to that particular organ or tumor and how we can spare the normal tissue from developing the radiation-related side effects. So with all of that, we are able to deliver high radiation doses to the tumor while simultaneously sparing the normal tissue. So this automatically translates to better outcomes with fewer side effects, or better recovery, speedy recovery for the patients.
This is brilliant. And so, Corey, this is a part of what you've been pushing for a long time, and now it has arrived, and we want to assure Barbadians that we do deliver world-class treatment for anyone diagnosed with cancer.
Sure.
And so with the outcomes, as you've just shared with us, Doctor, it is a no-brainer.
Yes.
That we don't have to expense ourselves further by trying to seek treatment elsewhere. We actually do have the expertise and the facility to be able to deliver that world-class treatment in Barbados. So anyone watching now can say, oh, I have a diagnosis, I need not fear. I put my hands in your care, and the possibility is, yes, that I will not die.
Yes. Very
I
much.
let your assurance.
Yes.
It is a solid yes.
Yes.
There's no hesitation or anything at all about that. I know there's some afoot who would say they want to move to see cancer now as just another chronic disease, as opposed to a deadly disease.
Yes.
You hold that view as well?
Definitely, because that's what I tell my patients. I tell them not to be depressed, that this is not an end statement, or I ask them to take this as a marathon, not a sprint. Having a cancer doesn't mean that they have reached the end point of their lives. No, even with stage 4 cancers, patients still have a really good life expectancy, like 5 years, 10 years, depending upon the type of the cancer, depending upon the tumor biology. So, it is not a death sentence. So that's what I tell my patients. And for 5 years, 10 years is not a less time at all. It is a significant part of time.
Right.
And so maintaining quality of life while trying to control the disease is very important for these patients in such particular instance. So that's what I tell them. It's not a death sentence. We still have a long more way.
Still have a lot of life in you left to go.
Yes.
And so, Corey, in terms of staying on top of the technology and the changes in technology so that we are always at the forefront, in terms of the capacity of the hospital now to be able to do all of that, to be relevant as changes occur, how are we in terms of training and everything else?
So that's going pretty good. What I would say is that we brought in a team of professionals to spend at least 9 months with us. And that team of professionals, their responsibility is also to impart knowledge, not just for the clinical implementation and the operationalization of the system. And what I can say is, since we treated our first patient back in November 2025, we would have done an excellent job, because in this 6-month period, patients started treatment. We reached numbers over 130 patients starting their treatment. Recently, we just completed our treatment course for the 100th patient, for example, in that time period. And this is just the start, right? We want to continue improving through this continuing education and development, ensuring that we have the right expertise, ensure that we are keeping up to date with best practices in the field. And I want to assure the Barbadian population that we are doing what we can in order to deliver safe, accurate, efficient, and precise radiation therapy.
We don't want anyone to come down with cancer, but there are things that we can actually do, doctor, to reduce our own, by our behaviors, our incidence of possibly developing cancer. What are some of those things, out of curiosity? How we eat, how we drink, the places we associate, how we don't smoke, those kinds of things?
Yes, definitely. So to begin with, making healthy choices, starting from the young age, like not having processed foods, processed meats, and red meats, because all of these are directly linked to all kinds of cancers. So consuming more vegetables, greens, fruits, white meat, and maintaining a healthy weight, because obesity is again linked to development of various kinds of cancers, and having an active lifestyle, and avoiding smoking, alcohol, and definitely having timely, regular health checkups, screening. So all of these would definitely help in reducing the incidence of these cancers.
Yeah. And we can do as much as we can, but yet sometimes we get that diagnosis. Now we know at the Queen Elizabeth Hospital we have a treatment opportunity for everyone. And so we've seen much success because it is more targeted and it does not affect the other areas. It just targets, treats, and you're good to go yet again. We give you life one more time, and it save you some money by having to figure out how do you travel to achieve what it is that you thought you needed to achieve. And so, well done, QEH. Well done to each of you.
Thank you.
Corey and Dr. Sripathi.
Yes, please.
Got it right. Got it right. Thank you so much. Good to meet you. And good to see you again, Corey.
Yes, thank you.
Thank you, Queen Elizabeth Hospital, as well, for the level of service that you continue to improve on and to bring to Barbadians treatment options that are being life-saving. We thank you so very much.
Morning.